Kia ora koutou, everybody. Welcome to what is our first interview with a practitioner during lockdown for COVID-19. We hope to communicate with other practitioners and really find out how they're coping with the present lockdown and how they're changing, managing their practice during that period. So a quick call out to anybody who wants to join us at a short half-hour interview to talk about their practice, or indeed to nominate somebody or shoulder tap somebody, if you like, to ask them to come along and have a discussion with me about how they're coping in this surreal situation. And when we've completed the recordings, they'll be available on our website, and we'll communicate to practitioners that we've put them there so that they can be a resource for people. So I'm joined with our first one with Tracey Partridge, who lives down in Christchurch. She's a private practitioner and has been for about 19 years. She has some ACC contracts, and a main area of work is working with clients who have a mental health issue or problem, working with post-traumatic stress disorders, and also traumatic brain injury. So she works from home, and you can see now she's at home. And she's got a whiteboard behind her, so it must mean she's at home and means business. And so that's probably my first question. How are you managing your practice, Tracey, during this lockdown period?
Tēnā koe, Andrew. Well, like everybody, I'm getting used to the new normal, the new routine. And it's not the first time for me or for many Christchurch-based occupational therapists to be in a situation where they have to work differently, to connect differently with their clients. I'm quite fortunate in that my office is at home anyway, so I'm used to remote access for documentation, and I have quite a good setup at home. But my main difference is I'm usually seeing clients in their home, so I'm driving to their homes or to a community-based setting, so that's extremely different. Being sat at a desk for all day, doing all my sessions, telehealth care is, yeah, extremely different and quite fatiguing because you don't have that break in driving between different people's houses.
Yes, and the practical setup you have at home, the computer or laptop you have and the connectivity to it, how's that working out?
That seems to be working okay in terms of the connectivity, but I always have to allow about 10-15 minutes for setup, just as we had today.
Yes.
Often there's a few hiccups either side with trying to get that connection. So allowing 10 to 15 minutes sometimes to eat into your session while that's sorted is needed. But some people don't like the telehealth care. They prefer to just have the telephone. So obviously that's much easier to just get connected.
How do you find that out? How do you find, what clients like when you reverted to remote accessing them, if I can say that?
Yeah. So in the first week, everybody just had a phone call, and that's where we talked about how they were feeling, how they were adjusting. But in terms of how our contact would happen, we discussed the options. And obviously we've got support from the board and from other places as well about how to do telehealth care. So each week I'm sort of updating clients on that as well.
Okay.
In terms of, what's got the best settings, the privacy settings. But they've normally got a choice of phone call or Zoom. And probably about a third like the Zoom and 2/3 prefer the phone call.
Right. On a practical sense, using the phone, what's your phone bill like? Or is it good to have a pay plan for something like that?
I actually changed as soon as I heard about the alert level 4. I phoned up Spark and changed my deal so that I could have unlimited phone calls, because otherwise I would have ended up, not earning a lot of money.
Right.
Yeah.
Okay. So what do you think are the challenges for practitioners now in this sort of remote way of working with telehealth or with the telephone service? If somebody was going to set up from scratch, what would your advice be to them about doing that?
I think testing your equipment is really important. I've got a PC and that PC hasn't got a microphone on it connected, and it didn't have the camera. Oh, it was the camera it didn't have, sorry. And so that's a problem, obviously. People need to be able to see you if you're seeing them as well. So luckily I had my laptop, so that had all the facilities within it. So I think just checking that what you've got has actually got the capabilities for the video and the audio system as well.
Yeah.
And obviously looking at how you set it up as well, so that if you're doing it by phone, that you're not holding it the whole time, because that's going to get quite distracting. So making sure that you position everything correctly. I haven't yet worked out how to change the background settings, which I believe you can do on Zoom. So
yes.
I think that might be quite nice. But
yeah.
I think clients quite like seeing where I'm based as well. Yeah.
So did you find, people can get very technophobic about setting things up? Did you have any resource you called on? Did you call a ninja to help or not?
No, I didn't call a ninja, but I was quite lucky in that I subcontract to 3 different services, and one of the services was very proactive and sent out step-by-step guidelines on how to set up and access Zoom. So that was really good. And so I copy and pasted that to my clients so that they had it as well. So that.
Okay. Can you say a little bit more about those services you contract to? What does that mean?
So there's three different services, and they've all got contracts with ACC. So I'm an independent private practitioner, and they send me referrals to see people.
Ah, right. Okay, got it. So not an IT sort of, you don't have an IT sort of company on tap or anything?
I do for one of those services. So if I had more complications, I could phone up that service, and they could then remotely access my computer and help me.
Right. Oh, that's very useful, I guess, when you're faced with technical difficulties. So you've got a contract with ACC. Now this has happened. What has anything changed about that?
No, because mostly my all my work is training for independence contracts, and that already incorporates into the contract that you're able to use telehealth to see your clients. So there was no concern. I'm aware that at the moment ACC are reviewing all their contracts and updating them if telehealth access wasn't included.
Yes.
But I was quite fortunate; it was already included.
And did they, like the ministry, have talked about what constitutes an essential service? I know it's quite a grey area, particularly for occupational therapy, because practice takes place in a great myriad of places, and actually identifying whether your practice is essential, it's been quite confusing for some people. Have you come across that, or did ACC anybody give you some guidance around that?
Yes, especially initially. For those first few days, it was quite confusing on whether we were an essential service or not. And obviously, again, because I contract to 3 different services, I would have different communications with those services as to what was deemed essential and what wasn't. And then over the few days, it became a lot clearer on what to do. Again, I think for me, I just thought, well, I've got telehealth. I'm just going to use those mechanisms to connect with my clients while this is happening. I knew that there wasn't going to be a break in the continuity of what we were doing in terms of contact. But yes, it wasn't that clear initially.
I think some of your work, if I understand, is obviously going and meeting with clients, and obviously in some respects, I suppose, taking them to situations, physical situations, to support them to do their shopping or whatever it is they want to do, but have some great anxieties around doing it. How can you do that on telehealth?
Well, for some clients, we have continued that. So obviously it depends on where we were going before because of the restrictions at the moment. But one client in particular was very anxious about going to the supermarket, but obviously needed to get food.
Yes.
And wanted to go and get it herself rather than use in an online order service and delivery service. And so what we've done is do graded exposure still with me talking to her on the phone as she's extending her walk and where she's going, so that she can ultimately be more comfortable being able to do that. Actually, with 3 or 4 clients, I'm doing something similar. It might be just getting exercise, doing a short walk each day. I've got a client who we were doing exposure work so that she could walk to a local school and help her son get to the school. And so we're still able to practice that, even though the schools aren't open. It's local distance. So again, on the telephone, we're doing that.
Okay. So really that the activity around supporting clients through telehealth has not changed for you then greatly?
It would be better if I was actually there, because then I could pick up on non-verbal communication as well, and I could see the environment. They do describe what they're looking at and who's around, so that helps as well. And it has helped in that, because I'm not there, clients are now looking at ways that they can be practicing that either on their own in a self-directed way or with Varno. So that's good. That's good, because the momentum is still carrying on for those clients.
Right. Okay. And I suppose under contract to an organisation like ACC, that management of clients that are under that contract and the progress that they're making and on which you get paid is something that is now happening through the ether, through telehealth. And ACC obviously are trusting your integrity to say, well, this is what I'm doing and this is the progress. Has the reporting mechanism changed at all in the way that you report on your contract?
No, so we write reports every 8 weeks, so that hasn't changed really. However, there's been a bit more communication with some case managers, just letting them know how the clients are and what's happening. It's coincided with a change in ACC's structure of how they do things.
Yes.
A lot of clients now haven't just got one case manager, they've got a group of case managers, and that's fairly recently changed for many of my clients. So that hasn't been ideal really, because the clients don't know who they necessarily are talking to at that time. So there's been a little bit of variability in how much contact I've had with clients, but we've had the regular updates from ACC encouraging us to keep continuing with the work.
Right. Okay. Well, that's good. And there's lots of apps out there. Have you found any apps for your practice that can augment and help people during this period?
A lot of them have apps that they've already using or that we've discussed before, like the Calm app is a really good app, Headspace is a good app. But the document that the Occupational Therapy Association recently submitted has been useful, because that's got lots of links in it as well. So
that's the toolkit, isn't it? They've just,
that's right.
And that's available on their website. Yes,
and clients are really liking that. So well done to OTNZ WNA for that. So that's great. And it's good because I can email it to them and we can go through it and discuss it together. And then the following week, we'll sort of look at what ones have been useful for them.
Yes.
Yeah, but many of them already have some apps that they're using already. And we found some new ways, like in the first week of the alert level 4 period, we were planning to do some flax weaving, myself and a client. And she was really disappointed that we couldn't do this. But she's managed to access an online flax weaving course. So that's really good. Not as easy to learn the skill, but you know, that's a good example of where if we keep exploring avenues, we could find some way of doing it.
Yeah. And normally you would go out, as you say, and visit clients. Now you're doing it across through telehealth. The amount of time you spend with clients, has that changed at all now? It's a different medium for interacting with them?
That's an interesting question, because I thought it would. And the first week it did reduce a little bit. Instead of perhaps an hour, which is my time with clients, it was 35 to 40 minutes for quite a few. But I think initially quite a few of my clients felt prepared for this because of their mental health experience, and because they'd isolated themselves a lot in life, and because they already had quite a few strategies in their toolkit, that they felt quite prepared for this. But by the second week, there were more challenges, and from that, has come the need for a bit more support, and so that the full hour seems to be used now for most clients.
All right. And that's your support to them. What about support to you? We know that OTs have got to have a supervisor. Who's your go-to person? Well, not, I don't want you to name them, but
right. Yeah, I've got an excellent supervisor, and she's Christchurch based, so that's really good. The good thing about subcontracting to 3 different services is I've got quite a big network there of support as well, and I can connect with them if I need to. I've also got my husband working from home as well, so every lunchtime we go out for a beach walk with the dog, so that's really nice to do. I've got my daughter at home, so we do yoga every day, so that's really important, because it is, the days feel longer when I'm just sat at a desk in the sessions.
Yes, I'm in the same situation. All the OT board staff are working from home now, and one of the things I voiced very early on was a sense of overworking. So having to evidence that, yes, I'm here at my computer, I have fast time answering my emails, and balance that with, I need to take a break and I need to walk my dog, and not feel guilty about that. And I've found that, in the 2 weeks, or coming up to 2 weeks now we've been doing this, I probably spend more time at my desk than I used to when I was in the office in Wellington. Do you find that, or?
Yeah. I think, well, I'm not doing the traveling, so really I should have a bit more time.
Yeah.
But it doesn't seem to be working out like that. Yes. Yeah. But of course, there's so much to read as well. We've got the information coming from ACC, from the Ministry of Health, from the board, from the association, from all the SIG groups. So there seems to be so much correspondence, and I wonder if that will start to reduce a bit. I'm not sure, but from that point of view, there's more email traffic to read. There's online learning. There's so many things. Yeah.
Right. Okay. You mentioned the SIG groups. I think there's a SIG group for telehealth.
Yes.
How are you finding that? Is that useful?
Yeah. What I'm finding really useful is B. Graham's sessions. They're really good. Unfortunately, I haven't caught up on the one this week, but that was good, especially that first week when it was breaking into subgroups.
Yes.
Because it was good to talk to others and see what they were doing, how they were getting their consent for their clients, what platform they were finding useful, because at that time we were slowly getting information from everybody else, but it was good right at the beginning to connect with other people and find out what they were doing.
Right. Okay. Well, thank you for taking the time. I just want to close on asking, I think we've probably broached on this, but how things are affecting you personally around, working from your desk, as it were, rather than going out to see clients. And it's just something that's popped into my head. When you see clients face to face, you pick up on their body language, as you said, and little nuances and almost intuition that something's quite not right, or they're not saying something, and you can feel that. Do you feel that through telehealth?
I think because I know my caseload, I know the clients quite well, and so I can, we've got quite a good rapport, so I can use humour, and that's really important at this time as well. So I feel like I can, if there's pauses or if there's a certain way something's said, I can sort of like, oh, I'm just sensing that, or, I might be wrong, but are you feeling, more fatigued, or it goes like that. But if it was a new client, I think it would be quite different. And I have got a client who's got a new therapist involved, and she's commented that it's different as well. And she's just given it longer because it might be because it's via telehealth.
Yeah.
My one big concern, which is worth raising, is I've got one client who's profoundly deaf, and that's raised some challenges.
Yes.
For example, having a Zoom meeting with 3 of us and working out the technology so that the person who's signing can see me, but not see the person who's interpreting. But the person who's interpreting can see the person who's signing. Otherwise, it gets very confusing seeing all the different images, and if I can hear the person translating, interpreting, plus the other person who's mouthing sounds a little bit at the same time, it can get quite hard for me to process both. So just getting the right system so that we're all working as well as we can, because for the interpreter, he needs to hear the mouthing movements as well. That helps his interpretation.
And are you using Zoom as a platform for that?
Yeah, we're
Okay.
using Zoom, yeah. And the other thing I just want to say about someone who's deaf is he had no way of contacting Healthline to start off with. So, because it's just a telephone number, and I couldn't find anything on the web page, and I messaged the Prime Minister, and I then eventually got through to the Healthline service, and you can access a New Zealand relay service where a 3rd person's involved, which isn't ideal from a dignity and confidentiality perspective, because that could change who it is and you don't know who they are. So yes, just wanted to point out that for people who are deaf, it's quite challenging at the moment.
Okay, Tracey, well, thank you very much for sparing the time to talk to us.
You're welcome.
And good luck with your continuing service, and the way you meet people and do your telehealth. And thank you for being the first person to sit and have a conversation.
My pleasure. Kia kaha to everybody.
Goodbye. Thank you, Tracey.
Bye. You're welcome.